Delivering a baby is in itself a heavy responsibility, and for some women this duty is performed with even more difficulty. Women who come from underdeveloped areas are faced with a myriad of challenges at the time of delivery. Transport is a major problem as one has to cover long distances to access health facilities. Many opt for home delivery, which may further complicate the situation should there be a problem.
There are some cultures that they don't promote women going to the hospitals. So they will tend to labor at home, stay for long. They will decide when it's too late to go to a medical care unit. Also, other issues could be cultural practices that may hinder a woman having a safe delivery.
Meanwhile, the woman endures prolonged obstructed labor, which may last up to 6 days. In the process, the soft tissues of the pelvis are compressed between the descending baby's head and the mother's birth canal. The tissue is denied blood and oxygen supply and is therefore damaged. The tissue dies and a hole or fistula forms. Through it, urine passes uncontrollably.
If the patient has had extensive damage such that the entire urethra is ripped off or a lot of the bladder capacity has been wasted, it becomes very difficult to repair that fistula. And even if you are able to repair, the hemodynamic functions of the bladder may not be present such that the woman will still continue to leak urine.
Fistula victims undergo untold psychological trauma as their situation subjects them to utter humiliation.
Lakini kama kwenda kanisani niliwacha sababu nikienda leo naona ni kidogo. Sasa nikienda kanisani nastokea makocha imekuja nikawacha kanisani. Sikuwa natembea, nakaa tu kwa mlango.
Veronica went through this for 8 years. The women are often abandoned by their husbands and rejected by their communities or even completely ostracized.
Mume yangu naye alikuwa anavumilia tu sababu alikuwa anaona hiyo sita vile ilikuja. Lakini nilifika hii rasti ya mwezi wa 11 ndio sasa akaniambia hapana, sitakaa na mtu mwenye ana mtoto, ni tukaachana mwezi wa 11.
In Kenya, the condition is prevalent in parts of eastern and northeastern provinces. Fistula can be caused by reasons other than prolonged labor.
You can also have a fistula due to road traffic accident where the fractured bones of the pelvis inflict injuries into the internal organs like the bladder and the uterus or the rectum. You can also have a fistula due to cancer of the cervix or due to irradiation for treatment of cancer of the cervix. You can also have fistula due to ulcerative infections that cause ulcers in the genital tract. And during surgery of the pelvis, a doctor can accidentally cause a fistula between the bladder and the uterus or between the rectum and the uterus.
35-year-old Jane Adhiambo looked well, even though she was wasting inside. An operation after giving birth to her second child left her with a fistula. Alice